Greetings everyone, this is Ivan Sergeyevsky. I'm part of Group 1. This is Debate 4. We're nearing the end of our summer term, so let's dive into our next discussion. So I will be arguing that a single-payer system will not cure most ills of the U.S. healthcare system. So to give you a little bit of background of what we're going to be discussing. Costs currently remain high for payers in the current U.S. healthcare system. Statistics show that 41 million Americans remain underinsured. This translates into out-of-pocket expenses totaling 10% of their income. Overall, we see that 28 million people remain uninsured in the United States. And so we see that this presents the need for continued healthcare reform. One controversial suggestion has emerged, which is the single-pay system. To implement a government-regulated single-pay healthcare system, in which private health insurance would be outlawed and the power of healthcare oversight would lie solely in the hands of government-appointed departments and officials. There are various pros and cons to the proposal. However, I'm going to be arguing that the cons outweigh the pros. This system is not suitable due to the following applications, and I'll go over a few alternatives to the system that can be used as well. So number 1, costs are simply too high, and tax increases would be insufficient to offset those costs. The U.S. currently leads in healthcare expenditures as compared to other developed nations. For example, the U.S. exceeds Switzerland, which is the second highest expending healthcare nation, by 28%. That's very substantial. So clearly the topic of cost is therefore a crucial discussion point of a single-payer healthcare reform. Senator Bernie Sanders has proposed a solid plan to reform American healthcare using the single-pay model. His act is known as the M4A, Medicare for All Act. It has been used as a comparative model for a single-payer system. However, economists predict that the proposed reform would increase federal budget commitments by approximately $32 trillion during its first 10 years of implementation. It's a big number, $32 trillion. It translates into a 10% of GDP value with an upward trend over time. The plan argues that increased taxes collected from individuals and corporations would offset the cost of the plan, but it turns out that even doubling all current projected taxes of the sort would be insufficient to finance the additional costs. So we see that even if we were to double all individual and corporate income tax, that still wouldn't be enough to offset the costs. That's telling you something. Providers and practitioners would see a decrease in salaries, which is our next point. So doctors, specialized care people, technicians who specialize in medical services would see a decrease in their salaries from a single-pay model. Because insurance companies would be outlawed under a single-payer model, the government would hold the sole power of reimbursing healthcare providers at governed rates. Those rates are projected to be 40% lower than those currently paid by private insurance. So 40% less in salaries is what practitioners and providers would see. Very substantial. Hospitals and special providers would be strongly affected by a single-payer system, of course. The effect would be adverse and cause major economic shifts within the industry. Now, a study conducted by the Centers for Medicaid and Medicaid Services, which we know as CMS, estimated that such changes would cause over half of hospitals in the U.S. to experience negative margins. The study also estimated that 80% of hospitals would lose money treating Medicare patients. Half of the U.S. hospitals would report negative margins. That would be a crisis in the healthcare system. We could see that it would be detrimental. And 80% of hospitals would lose money treating Medicare patients. What would be the incentive? That would be very unattractive. Now, switching over is unlikely among people. I mean, just simply put, the ACA currently serves people pretty well. Most people report having ease using the exchanges. They continue to do so, and although the Trump administration has tried to undermine some of the provisions of the ACA and has limited the mandate, which was a favorable decision, I will agree, the ACA continues to rule and continues to manage the current U.S. healthcare system. So why change? Why give that up for something else? Especially something that is going to ask for more of your tax, for more tax dollars from you. Taxes are unfavorable amongst the majority of people, and you would need to convince people that you would need to give up your premiums and instead pay more taxes in order to have such a system in place. and quality of care would not improve under such a model. It would likely utilize the fee-for-service system, which we have seen to be detrimental for quality in the U.S. healthcare system. Good healthcare relies on collaborative efforts among providers. The fee-for-service system does not incentivize providers to collaborate. Instead, it encourages providers to pass around patients and perform unnecessary and costly services. The system rewards poor quality. If a patient does not feel better after a doctor visit, then the patient will require continued care, benefiting the provider's income. The fee-for-service system is subject to fraud and misallocated spending. It ultimately misuses taxpayer dollars without improving healthcare. And of course, total federal control over healthcare is largely unattractive. It's unconstitutional. A single-payer system would enact total federal control over healthcare. How many people would want that? It would effectively outlaw insurance providers and hold complete oversight over the expenditures and finances of the U.S. healthcare system. Now, many argue that this is an unsuitable model for the nation, that the government should not have so much power over a human right. Healthcare is a human right, after all, and the government cannot have full say over how much it costs and from who you could receive healthcare services. It's unconstitutional, and we have seen that previous healthcare mandates, such as the Obamacare mandate, has been met with opposition and has been voted out of practice. Now, this particular one is one that I think is important to consider. There would be a decrease in research and development. There are countries currently using the single-payer model system. Canada, for instance, up north uses a government centralized system that provides residents with affordable health care at the expense of decreased expenditures. As a result, there's less funding available for research and development. And so guess what we see? Our nation continues to utilize an alternative model that has earned an outstanding reputation, known for exceptional breakthroughs and innovations. So, Canada doesn't have much breakthroughs or innovations. The U.S. does. The U.S. is also known for being a leader in spending and expenditures in the healthcare, but we can see that it comes with results. And ultimately, for the long term, I think people would agree that we would want to see more research and development so that we can continue to prevent and fight any diseases or illnesses that we might see in the healthcare arena. A single-payer system would curb this progress and place the nation's long-term well-being at risk. The effect would be felt globally as well, as the U.S. leads the world in medical advancement. So the U.S. is looked upon for answers in the medical community. If the U.S. was all of a sudden to curb its funding on research and development, that would be felt around the world. Now, what can be some alternatives to the single-pay model? Well, there are several alternatives that have been proposed. For instance, the Center of American Progress Health Policy team has proposed a plan that uses a model called Medicare Extra for all. Under this model, the healthcare system would remain largely intact as it currently is, but it would provide increased availability to enroll in government-subsidized healthcare coverage. This model aims to reduce taxpayer dollars, maintains current progress in research and development, and expands Medicaid coverage in the U.S. and keeps costs low for participating citizens. So this is an all-stakeholders win situation. Another favorable alternative has been presented by the Institute of Medicine. This model would encourage value-for-money competition among health plans. Exchanges would ensure sufficient and not excessive regulatory measures. The government would assist citizens in premium payments, effectively lowering costs. A consumer choice market control is best suitable in this model. And so this model argues that the competition will be better off just competing with itself, lowering prices, having the government with the most minimal regulation, but enough needed to avoid fraud and to avoid misallocated funding and some kind of harmful actions caused by providers and stakeholders involved. So, in other words, you want some regulation from the government because they act as a broker with their exchanges and keep things even, much like the stock market is regulated. But you would still have competition unfold naturally as it would, and over time it would even the playing field and the costs would be favorable. It would be low for people to have healthcare coverage and services. That is the end of my argument, and I look forward to reading the rebuttals of our opposing group. Thank you very much for your time. I hope everyone is having a good summer and staying safe.